Hi, everyone, and thank you for joining us today for the collision of the opioid and COVID-19 public health crises, the Commonwealth of Kentucky's perspective. I'm Carol Dorn-Sanders, SVP of Marketing and Communications, and are thrilled to be hosting this virtual discussion today, focusing on the Commonwealth of Kentucky. Our town hall type session is the second in our series of webinars that we are hosting to draw attention to the states that have been particularly hard hit by the opioid epidemic and the pandemic. And now I would like to introduce you to our moderator, Jana Bailey, who is an advanced practice registered nurse and serves as a certified registered nurse anesthetist in Kentucky. She is in her first year on the Kentucky Board of Nursing and the first CRNA to serve in this capacity. Jana, thank you so much for being with us today and helping to lead our panel.
Thank you, Carol, for the opportunity to be a part of this discussion and to moderate it. As the immediate past president of the Kentucky Association of Nurse Anesthetists and a CRNA, I unfortunately see daily the impact that the opioid epidemic has had on our patients and their family. And also during my term as president this past year, we started a grassroots opioid stewardship initiative with one of our panel experts, John Edwards, to help us enable CRNAs to fight the epidemic on ways that we're able to, both inside the operating room, but outside in our communities. And that's kind of what I see this panel as. It's the opportunity for each of us who are doing it within our organizations, our professions, our practices, tackling the problem in an expert way to make a difference. It's a multifaceted problem that's not going away, and it needs battling on many, many fronts. And that's what we're all doing. We're working together in ways to bring about improvements and learning from each other, which is very important in my opinion. So just also as a reminder that while I am serving on the Kentucky Board of Nursing right now, my opinions today and my comments are strictly my own. They're not representation of the KBN. So that's my disclaimer. So just a couple background things. And I think a lot of us know this, but for anybody listening who doesn't, according to the American Medical Association, Kentucky is one of 40 states that are reporting increases in opioid-related deaths in recent months. In fact, EMS crews across the Commonwealth are seeing spikes in our opioid epidemic overdose runs that they're transporting to the ER. Unfortunately, or kind of weirdly, we're having an increase in that, but all of their other runs are kind of stabled or actually have leveled off. So that tells us where we're at with the opioid crisis. Experts believe that this isolation and loneliness is due to the lack of access to counseling currently, treatment and financial hardships that are contributing to opioid overdose deaths right now. Kentucky, unfortunately, has also been the center of the opioid epidemic, as well as our deaths and despair and suicides going on. Right now, we know local, state, and federal officials have committed hundreds of millions of dollars to help treatment, recovery, and prevention efforts in recent years. But our other businesses and healthcare organizations, our nonprofits, our coalitions, our individuals, we're all engaged in battling this to help the colliding crisis so that we're all trying to help come together with this. So I really am impressed today that the collaboration that I'm hearing from people on a regular basis, everyone who's committed to battling this opioid problem, especially now that we're dealing with the stressors of COVID-19 on top of all of this. So today we've assembled a distinguished panel of guests who are working tirelessly to improve lives of Kentuckians. They all have their unique roles of what we're doing within our own organizations, but we share our common commitment to address the addiction problem and our opioid crisis. So on our panel today, we have Dr. Kelly Clark. She's an addiction medicine specialist from the Addiction Crisis Solution. We have Natalie Middahl, a community health program manager of Kentucky Health Collaborative. We have John M. Edwards III. He is a CRNA from the Baptist Health Lexington. We have Lisa Smith, Senior Director of Clinical Excellence at Walmart Incorporated, and Halisha Ward-Turek, Program Coordinator of AmeriCorps Seniors and Morehead State University. Now, what we're going to do today, we're going to start out by asking each panelist a question, and we've asked them to limit their responses to roughly 3 to 5 minutes. That will allow us a little bit of time to have a group discussion afterwards, a little bit more on the topic. So we're going to start out with Dr. Clark. You are the past president of the Kentucky Society of Addiction Medicine. You're currently serving as the co-chair of the COVID-19 Rapid Response Task Force for the American Society for Addiction Medicine. Thank you for that. And as we watch these two public health crises collide over the past 9 months, can you share with us what you think your initial concerns were early on in the pandemic and what you fear as the pandemic's continuing, especially as we head into the holiday season?
Absolutely, and thanks for the opportunity to speak on this very important matter today. Early in this crisis, I had very similar concerns to what I have right now, which is how well will each of the important stakeholder groups be able to respond quickly and appropriately to the changing conditions because of COVID. So employers, payers, regulators, and health service providers all need to make changes, as do patients during this time period. And when you think about specifically patients dealing with addictive disease, let me start backwards and go forward. So let's start with people who are in treatment or accessing recovery services, being able to maintain those. So problems with people who are really used to getting their face-to-face support groups with their peers, suddenly not being able to do so. Issues with treatment programs which may not be medically or have any medical personnel on staff to understand how to mitigate and decrease infectious risk in the populations. And as those staff also go out sick, how do we maintain those kinds of treatments? Also, the issues with getting people into treatment once they determine that they have a problem. And so there have been some regulatory changes that allow people to start. We know with opioid use disorder, the key component of evidence-based care is for people to get on and stay on one of the 3 medications for maintenance treatment of opioid addiction. But 2 of those require in-person evaluations under federal law. Now that softened during this crisis. Now only one of them does, methadone, but the ability for people to enter treatment. And then upstream further, the issues with people who are having more and more problems with addictive disease, either developing addictive disease or having a flare-up. This is a sort of relapsing remitting disorder, right? So it can be calm for years and then flare up, and calm for years and flare up even. And so what we've seen is not only an increase in opioid overdoses, which we've seen in Kentucky as well as mentioned, across the country, 40 states, but also we've seen an enormous increase in drinking, and we've seen an enormous increase in the use of sedative and hypnotics, benzodiazepines like Klonopin and Xanax and Valium. Yeah, I mean, after 10 years of decrease, the first part of this year, the prescriptions for those went up 30%. And the problem with those are you mix any of these 3 things together, opioids, alcohol, and benzodiazepines, and your risk for an unintentional death goes through the roof. So I've been very concerned about all of these things, particularly as people are now sort of being stuck in the home. So and the other concern was around criminal justice system, because a lot of people with addictive disease are involved with petty crime and prostitution and things that just rotate them in and through jails, which are incubators we found nationally for COVID. And what we've seen nationally is that people with addictive disease, once they are infected with the virus, have a higher rate of dying than the rate of people dying who are infected with the disease who do not have an underlying addictive disease. So we know that this is a problem. So those were my concerns sort of starting out. It's been helpful to see some of the flexibility shown by the federal government, by the state government, by the payers in Kentucky for paying for telemedicine and et cetera. But, as we're heading into this, particularly into this holiday season, where we're one of those 7 contiguous states where our governor has said, don't join together in the traditional Thanksgiving holidays. We've got people who are at home with increased access to alcohol, increased benzodiazepines in the homes now, as we know, and using for stress release and pain management some of the medications that they may have had in the cabinet rather than go in and see their providers and get more appropriate treatment, mixed with that increase in stress where people not only are increasing their use of what's there in the cabinet, but stress may be driving misuse. So this is a particular concern for me coming into the holiday season.
All right, thank you.
Easy
So,
answers, I know.
easy answers, some of which I was familiar with and had already anticipated, but also some that I wasn't. So that's good. So that's what this is about. All right, Natalie Middall, your organization, the Kentucky Health Collaborative, brings together employers, healthcares, and stakeholders to solve big problems. It's a model that's being duplicated in other states around the country. So proud of that. I know that opioids in the workplace is one of your main initiatives. Can you tell us a little bit more about that program and how you see it has evolved during the pandemic?
Yes, absolutely. And thank you for the opportunity to be here and be a part of this panel today. So our investment in this topic really began back in 2017 at the height of the opioid epidemic. And it was inspired by a call to action from our employer members within our organization. They saw the impact that substance use, opioid use, and mental health were having on their employees and their families. And they recognized the unique position that our organization had in the community to really make an impact. So in that same year, the Kentucky Health Collaborative partnered with the Kentucky Opioid Response Effort, which is also known as CORE, which is a federally funded program through the Substance Abuse and Mental Health Services Administration and is administered through the Kentucky Department for Behavioral Health. And the focus of this program is really to expand and sustain a comprehensive and equitable recovery-oriented system of care to help in ending the opioid epidemic. So the KHC and our partners at CORE realize not only the impact that substance use and mental health is having on employers, but also the potential for employers to be a significant agent of change in this problem. So in the past 3 years since this partnership began, our Opioids in the Workplace initiative has supported employers in quite a few different ways. First, we identified best practices for employers through data analytics, benefit design, and workplace policies for the prevention, treatment, and recovery of opioid use disorder, as well as pain management through the development of the Opioids in the Workplace Employer Toolkit. And this resource was developed using the multi-stakeholder approach that the KHC utilizes and incorporated addiction science as well as evidence-based practices with employer perspectives and priorities in order to have the maximum impact. And this resource has been made widely available to Kentucky employers over recent years and has also been adapted by the states of Alaska and Montana for implementation in their state. And following the release of this resource, the KHC convened a group of 22 employers who represented about 23% of commercially insured Kentuckians and convened over a 6-month period to really dive deep into the best practices that were highlighted in the toolkit and explore and collaborate on what these best practices look like when they were implemented, what successes were employers seeing, what challenges were they facing throughout the process. And another notable aspect of the Opioids in the Workplace initiative was the development of state and local benchmarking claims data in partnership with IBM Watson. Using the measures that were identified in the Opioids in the Workplace toolkit, we established benchmarks for employers to compare their own data to identify where they may be behind or ahead of the rates within our state as well as a national level. The Opioids in the Workplace initiative has also included a variety of educational opportunities through webinars, events, and employer roundtables. And currently, this initiative is focused on working to develop a training program as part of a voluntary employer substance use program that's being developed by CORE alongside the Office of Drug Control Policy, which will be completed in the summer of 2021. And since the onset of the COVID-19 pandemic, our focus has really continued to be on education and collaboration. We've seen the necessity of keeping employers updated on many of the trends and healthcare changes that we're seeing that Dr. Clark has already highlighted, and keeping them up to date on what that looks like so they can relay that information to their employees, so they can have informed conversation with their healthcare partners in order to continue to maximize those prevention, treatment, and recovery services that are so needed. We've also expanded our conversation to highlight the inequities that have been displayed through the COVID-19 pandemic, as well as help employers recognize the racial trauma that many of their employees are experiencing due to the events of this year, as well as the historical and contemporary effects of racism. So all in all, we're continuing to encourage conversation and information sharing between employers and how healthcare services are adapting. And we've really seen the value that this transparency and collaboration can add for employers as well as other healthcare stakeholders as we continue to move forward in this pandemic.
Thank you. So very good program. So, all right. Well, Lisa Smith. Lisa is Walmart. Walmart has been the pioneer of many chain pharmacies. They've been invested in the Opioid Stewardship Initiative a number of years ago. And how broad is your program currently today? How would you also say the pandemic has affected your efforts right now?
Thanks for the question. I'm a pharmacist by education. I sit on our clinical service team. I'm a very proud University of Kentucky College of Pharmacy graduate. So I feel a connection to the state of Kentucky, even though I'm based in Arkansas now here at our home office. But Walmart has operated a controlled substance stewardship program nationwide, as you said, for a number of years. We've really looked to figure out how we can look comprehensively, both as us as a healthcare entity within Walmart, but then as a corporation as a whole. So we really have a focus on responsible dispensing, proper disposal, community and patient education, as well as naloxone access. And so we were the first pharmacy to institute an initial acute opioid dispensing limit. Many of the states, Kentucky included, have come on board and tried to limit those. Our goal there is really that we don't want people entering this epidemic with an acute prescription and being on it longer than they need to when they have a dental procedure done or something like that. We really, really encourage every patient we dispense an opioid to use the lowest effective dose for the shortest duration. I think Dr. Clark brought up something really, really important about those medications in the medicine cabinet at home, and people are isolated, and proper disposal has been a core tenet of what we've worked to do. We were the first pharmacy to provide at-home disposal solutions in all of our pharmacies at no cost. And so making sure that they have that option, as well as the kiosks in the stores that most people are very familiar with. What we've seen in the pandemic is that at-home disposal, I think, has grown in popularity. People don't want to make that extra trip back out of their home to dispose of it. With the cancellation of the spring DEA Take Back Day, we saw here this fall, when they started it again, that people had a lot of medications that needed disposed. So there's that pent-up demand, and it's really important that we keep those medications where they belong, either in use or disposed of. We don't want to have those medications left over. Also, patient education and community education. We, through our Prescription for Life program that we partner with EverFi, getting into those middle school age kids and educating them about prescription use and misuse. That's often where some of these things start, unfortunately. So providing that education, which we've now moved online and opened up to adults. Naloxone access has really been another tenet of making sure that people can access that without a prescription, talking to our pharmacist in every single state and territory that allows. So that has been extremely important, as well as just continuing to keep our providers up to date on the most recent educational opportunities. All of our pharmacists go through a 6.5-hour pain management forum in conjunction with the American Pharmacists Association. And this year we have expanded that access to all pharmacists nationwide. Walmart is paying for that if they would like to take that course to educate themselves. It includes information on substance use disorder, empathy training, behavioral interviewing, to really make sure that we're educating our patients and our pharmacists in the best way possible. The only other thing that I would add is we don't have any in Kentucky yet, but our newest format for serving customers in healthcare, Walmart Health, mental health is a core tenet of our expansion of healthcare services. All of our Walmart Health facilities have behavioral health counselors on site offering accessible, affordable counseling in areas that oftentimes have an accessible accessibility problem as it relates to healthcare. So that's something we're really proud of, because we know with this pandemic, the mental health crisis is only increasing. And we have had to change our ways of working. As Dr. Clark said, we're offering more curbside, high-risk shopping hours, delivery, making sure that people can safely access care during this pandemic. So thanks for the opportunity to be here.
I was very familiar with a lot of the things that Walmart was already doing when we started our opioid stewardship program to try to help some of the pharmacies that weren't able to do this at this point. So excited to hear some of the other things that you all are doing too. So thank you. So, all right, Halisha Ward-Turek, you're up next. My question for you is, you manage 2 AmeriCorps grant programs and you serve a 15-county area of northeastern Kentucky. And I know that it's an area that's very hard hit by the opioid crisis. Can you share with us some of the information about the objectives of your grants, how you've had to adapt those with the COVID-19, as well as your tie with Morehead University?
Yes, good afternoon. Thank you, everyone on the panel. I've learned a tremendous amount of information already, but for as our grant, what we are formerly known as Senior Corps. Now we've had a brand changing. We are AmeriCorps across the board now, AmeriCorps Seniors. And what that is, just to give you a quick update what that is. AmeriCorps Seniors is a network of national service programs for Americans 55 years and older. And it's made up of 3 primary programs. Each take a different approach on how their volunteers are volunteering. They volunteer in different aspects. They approach the improving lives and fostering civic engagement. AmeriCorps Seniors volunteers commit their time and their efforts to address critical community needs. And currently, the pandemic we were battling before the COVID-19 was the opioid addiction. But due to COVID-19 pandemic, we've kind of had to put our efforts on the battle of the previous pandemic that we were dealing with, which was opioid addiction in our community. We've kind of had to put those efforts a little bit dormant till we get some issues addressed on how we can continue our volunteer efforts during this pandemic. Basically, our objective with the AmeriCorps Seniors is early prevention. So what we do, we place our volunteers in the school, the local school districts, and we provide them with an evidence-based drug prevention curriculum. We purchase the curriculum for the school district. It's a curriculum of their choice, as long as it's evidence-based and endorsed, CDC endorsed. Typically in our area, most schools prefer Too Good for Drugs. It's what they're familiar with, and typically that's what they go with. And with that program, it's very successful because it starts at kindergarten and it follows them all the way through grade 12. And what our tutors do, they serve as facilitators. So what they do, they lead those scripted lesson plans. They start the drug prevention lessons very early, like in kindergarten, and they lead all the way up. And studies have showed, especially in the southern and eastern counties in Kentucky, the first age that students come in contact is age 11. So for our area, it's very important that we do drug prevention very early. We usually target elementary. We don't want to wait until they're in middle school till we introduce these skill sets and life skills that they need to prevent and to recognize opioid addiction. So basically what our tutors do, they go into the school and they do the lesson or whatever curriculum they have planned for that day. But some of the adaptations that we've had to do to the COVID is we've had to give training to our volunteers for technology on the different social media platforms such as Zoom, Google Classroom, Facebook, and FaceTime, different ways in which they can still continue their lessons. So that's one thing that we've had to do, and also working in conjunction with the school district and the teachers on how to do those take-home lessons, because a lot of our rural areas do packets. They don't always have great internet access, and Wi-Fi is not always available to every household. So the volunteers will copy packets and they will distribute those. And then once those return, they can help the instructor or the teacher grade those packets so they can continue those lessons. We serve 10 counties, our RSVP AmeriCorps Senior. So we're in 10 counties, which are north and northeastern counties of Kentucky. And the other grant with Morehead State University that is also doing the opioid drug prevention is our Senior Medicare Patrol grant. And what that grant is also a volunteer-based program. And the mission of that grant is to educate Medicare beneficiaries, caregivers, and family members how to prevent Medicare and Medicaid abuse. But with that, what we have found in our area is that we have a lot of grandparents, great aunts and uncles that have become guardians of children due to parents losing custody due to opioid addiction. So what most of our volunteers do with the S&P grant, they work within the senior citizen centers and they help provide warm meals, or they'll do the curbside service. And when they do that, before COVID, what we would do, we would have our volunteers give educational presentations that focused around opioid prevention. They would tell them we focus on the accidental dealer. We would inform them what that is, what that means, and we would try to promote on how to prevent becoming an accidental dealer. So right now, one of the challenges that we've had is the closing of the senior citizen centers. They only do curbside service at this moment, or they'll do home delivery of their nutrition meal plan. So our volunteers have become very creative. So what we do once a month, when these meals get distributed or picked up by curbside, we give each senior a expo bag that is filled with different information, literature, and different topics that they need to know. And we include infographics and flyers that promote opioid prevention. And in doing that, we've also had to provide our S&P volunteers with the same type of technology training on how to utilize, Zoom, Facebook, all the other social media platforms that they would need to continue their awareness in their group outreaches.
Nice. I like the gamut. We've got all the way from kindergarten all the way up through. So again, we're all tackling this in our different respective areas, the different populations, because again, this isn't something that's fought on one front. We've got to do it on many fronts. So, all right, our last panelist is John Edwards, and you play a key role in the opioid stewardship program at Baptist Health Lexington. In fact, you've actually presented nationally on this subject, as well as helping our organization bring a similar program to the statewide CRNAs for their opioid stewardship initiative. Can you tell us a little bit more about your efforts and the successes you're seeing, and perhaps some of the challenges you're facing currently at your hospital setting as a result of COVID-19?
Yeah, thanks, Janet, for the introduction, and thanks for everyone for having me on today. I appreciate the opportunity. And, one of the roles that I play at Baptist Lexington is I co-direct our acute pain service. And I realize that, we have worked very hard to implement all types of acute pain management protocols throughout our surgical service lines. And so that's been a huge success in our ability to manage pain well, both before the surgery, during the surgery, and after the surgery. But how can we prolong, acute pain management beyond discharge? And that's what we try to do. But I realize that, the opioid epidemic is such a huge thing in our country, and it can be overwhelming in the scope of that. And so the challenge that we see is how can we help reduce the amount of opioids that end up in our communities. And so through our acute pain service, we've developed an opioid stewardship initiative. And that looks at, how many opioid pills are leaving our facility through prescribing. And then on a bigger piece, what kind of education are we doing to our patients on the safe use, the safe storage, and the safe disposal of those opioids. And then finally, providing a way to reduce those opioids in the community by getting them disposed of properly. And so, a lot of the research shows that there's many ways to dispose of these opioids through, flushing the medications, mixing them with unpalatable substances, opioid take back events. And in fact, research in our own state, showed that all the opioids that were, dispensed, only about 0.3% were actually taken back through those events. And so I believe that the in-home disposal of opioids is the most convenient way to do that, through an in-home opioid disposal product, such as DisposeRx. So in our facility, through our outpatient retail pharmacy, if you use our meds to bed program as a patient, and you receive a filled opioid prescription, you're going to get an education brochure that we've designed along with an in-home opioid disposal packet, a DisposeRx packet to, provide that patient that kind of convenient, quick way that, hey, 2 weeks after surgery or surgical procedure is over with, now you can dispose of those opioids quickly and conveniently in your home. And we've seen really good success with that. We send a little postcard home with patients and they can return it to us anonymously. And we've received great feedback from those on patients who will say things like they disposed of all of them, or they'll say things like, I wish we would reduce the amount of pills that patients are going home with. I had too many, these kind of things. And so we've seen that. And now we're going to build upon that and even work on a study and do like a post-intervention survey to help figure out some of the demographics and some of these things better to kind of get some more inferential statistics on how that's going. But as far as the COVID, pandemic that we're seeing, it's a huge challenge in healthcare, as we all know. And it really is, we're still seeing lots of patients who are having surgery, lots of patients who are going home with those filled opioid prescriptions. I get a monthly report of how many prescriptions that they send home and how many of our education and in-home disposal packets are going home. And, these numbers are still very, very, very large. So I'm grateful for the support that our facility provides in providing those for our patients.
Right. Well, we're going to spend the remainder of the time. Thank you, John, by the way. We'll spend the remainder of the time kind of going over a couple of questions, and this is for the group. And we'll just kind of take our turn chiming in if you've got some answers or input that you want to add. So our first question is going to be, is there enough public or private collaboration to address the issues that we've discussed so far? Who wants to go first?
I can jump in.
All right,
So,
Natalie.
yeah. So I think there can always be more. As organization was collaborative in the name, we always are pushing for more of that among organizations.
I'm kind of scared to go out there.
We've seen a lot of success with this in the employer arena around the issues of substance use, opioid use, and recovery. There are really strong partnerships around our opioids in the workplace initiative, but we've also been well supported by, as I mentioned, the Kentucky Opioid Response Effort. The Kentucky Chamber has been a huge leader in this space in removing barriers to work and employing people who are in recovery and partnering with their business members and really facilitating that alignment of priorities and identifying gaps in each organization's own initiatives so we can think about how to meet the broader need together. So I've seen the existing collaborations be extremely effective, but of course there's always opportunity for more, especially considering the increases that we are seeing around overdoses and in mental health as a result of the pandemic.
I agree. All right, who else wants to chime in?
I'll chime in.
All right, thank you.
Okay. I think especially in our area that we do need to focus on a little bit of more education and awareness for our community. And I think that's due to the fact that we have such a large population of grandparents and like grand aunt and uncles that are custodial caretakers of children, and they may not know that they have a leftover prescription of opioids from a previous procedure or surgery that's just in their medicine cabinet. And then all of a sudden they have a preteen or a teen living in their home, and then they get their first exposure to opioids. So they may not know how dangerous that is to have these leftover medications. And if we can go into our community, especially in the school system in which the older population are the caregivers, and educate them on what the accidental dealer is and how they can safeguard their medications, proper storage, proper disposal, have the disposal packets available at the schools if they need it, or they can contact one of our volunteers and we can provide that with them. And that gives them the at-home access to dispose of those prescriptions properly and safely. And also it's a good opportunity to have the little postcards of the instructions to where a student could read that, follow that, and to help their grandparent dispose of that, to actually use the product themselves. So I think definitely in our area, we do need to focus a little bit more on education and awareness at a very young age, including the student and the caregiver.
So let me just piggyback on that for a minute at addressing both what Natalie and Halisha just said. Of course, we never have enough public-private partnerships, but we can also never have enough partnerships in this area because it is so interconnected and multifactorial. You know, just so two simple examples. In Baltimore area, the police have basically stopped arresting people on low drug possession charges as part of their sort of justice initiatives and because of COVID. And an outcome of that has been that a large chunk of the treatment system in Baltimore was based on court-ordered referrals, as well as their dollars for doing their work. So had they been in rooms together, they could have anticipated this, right? And gotten ahead of what was about to happen and made plans. But too often we work in silos, just as people don't think about, you know, often about the Medicare population as being getting pregnant because the disabled population is on Medicare, and also don't think about the elder kind of, or not even that elder population of grandparents and granduncles and et cetera, becoming primary child caregivers. It was 10 years ago when Karen Kelly at that point at Operation Unite, now with Congressman Rogers' office, told me about a school in Eastern Kentucky with 300 students and 30 dead parents. And another school where parent-teacher day was canceled because so many of the parents were incarcerated, in rehabs, or dead. So the requirement for us to all come together in, as Natalie was talking about, collaboratives to really understand what levers we can pull together and plan for the outcomes of that couldn't be any more urgent for us.
Agree.
Yeah, I'll chime in and say, one of the collaborations that I've seen be very successful in our facility, through a core grant through the state of Kentucky, we were able to hire basically a nurse addiction coordinator in our facility, along with a peer support person. So as a team, we've been able to bring them into the facility and be able to really engage a lot of our patients who struggle with substance use disorders. And that's been a huge collaboration with an outside, entity through the state of Kentucky and then in our own facility. So I would like to see more of those kind of things, because as a healthcare provider, oftentimes, we're challenged by, how to manage, all these types of patients and how to meet their needs, because, every patient has a different need and we need to be able to meet those needs. And so this has been a great way for us to do that. And I would love to see that type of collaboration grow.
I think also on the private side, Natalie mentioned employers, but when we think about the private sector, looking holistically at your employees and what are the benefits that we're offering, there's such a stigma around mental health and addiction as well. So how do we talk about it from an employee benefit standpoint in a way that normalizes the conversation? And many employers, mine included, have a vast array of things that we offer to our employees, but it's just making that knowledge known, reducing the stigma, and really that education from a benefits perspective around what's offered, but then also providing the beneficiaries that opioid education as well and the risks associated with it. There's so many folks who are still unaware or don't even know, they hear fentanyl on the news, but they don't realize that there's a lot of opioid medications and a lot of benzodiazepines, and a lot of these things fall into these categories. So just continued education, I think, within the private sector can be so impactful as well.
I'm going to kind of tie these two questions in together. One of which is, do we think that the prevention education is currently working in Kentucky right now to curb our addiction and misuse? And if so, or if not, where are our gaps? Is it funding? Is it access to treatment? Is it mental health illness, behavioral health support? So this was, again, prevention. Is it working in Kentucky? What are our gaps that we're dealing with? What's causing it? Is it access? Is it the behavioral treatment, et cetera? So who wants to go first with that one?
Okay, I'll go.
Okay.
Okay, to answer that, yes, I do think education will work if it's done properly and consistently, especially where our focus is with elementary students and all the way up to high school students. It has to be something that's done consistently. It can't be done just once a week, a year during Red Ribbon Week. And we have found out where our tutors are in the schools in which they implement Too Good for Drugs or Botman life skills. When they do that as a curriculum that's compulsory all year long, we have much better results with our students. There's less use, there's less exposure, the awareness is there. And I think with children, it's just repeat, repeat, repeat. And the more that they can implement that as a core subject, which is not looked at as core, but we feel that it is just as important as reading and mathematics and the core subjects, because opioid addiction, once that gets seated in a family, it completely destroys that family all the way down to the students. Everyone's affected. But unfortunately, a lot of the school districts do not have the funding to implement that all year long in a year-round curriculum because they don't have a certified aide or an extra teacher to focus on that. So what our tutors do and what we can do with our grant, we purchase those materials for that school, which that frees up their budget. It allows them to use that budget for other deficits they have. So we can purchase the materials. Our tutors act as the facilitators. I'm happy to say a lot of the tutors, especially in our eastern counties that's in our schools, are our retired school teachers. So they completely facilitate the program. They plan their lesson plans, they do the instruction, they do a fabulous job. I cannot brag on our tutors enough who do this. If they are not comfortable with leading a lesson plan, then they do all the prep work for the teacher or the guidance counselor. So we can go in and kind of fill that funding gap, but we don't have the funding to supply it for every single school district that we serve. We would love to. So I think if we could get enough funding to give the schools the curriculum and the person to facilitate it, I do think we would see improvement across the board for sure. And early prevention is the key, at least in our area. And it's not only educating the students, it's also bringing in the grandparents or caregivers and parents also that are battling addiction and trying to get custodianship back. It's important to bring the whole family in so everyone's in on the same basis. So we're big advocates of education, especially Morehead State University. Educate is the first line of defense for us in our area. You have to inform people on what they need to know. Then you have to have the funds to implement that, to supply them with the materials they need.
We constantly agree. Education is the key, and then you've got to provide the tools. So I saw Dr. Clark chiming her head in. Did you want to go ahead and respond next?
Actually, I thought John had his mic unmuted first.
Sorry.
Either way, Dr. Clark, I was inspired by her discussion on education there. I'm in the process of writing a systematic review on, opioid education and disposal practices. And there isn't a systematic review in the literature as we've reviewed this. And so as we're critically appraising the 8 or so really good trial studies that we found, the main thing that comes up over and over again, and the gap that really is in the literature in an education area, is the planned retention of opioids. Every one of those studies looks at, people are willing to potentially dispose of their opioids, but most people plan to retain them for future use, or if they have some pain that they might have in the future and they think opioids are now hard to get. And so they're afraid to dispose of them. And so, the challenge is in the education piece that we want to develop for future study is really to challenge people on that planned retention rate and help them understand that the dangers of that, the potential that the patient then, misuses their own medications in the months to follow their surgery, or, as we've heard in the school systems, the diversion of these opioids as they leave the medicine cabinets, get into the school system. So really the current literature supports that people just plan to keep them. And we have to find a way to encourage people to do that. And, how do we do that? That's the question, through financial rewards, through turning their medications in for some other type of gain. I'm not sure. We're trying to figure that out ourselves right now, but that is a big challenge.
Yeah, I'd like to just make a comment about how we as adults tend to think about, prevention and et cetera in terms of children and youth. And the truth is that the highest rates of overdose from opioids in the Commonwealth is 35 to 44-year-olds, followed by 45 to 55-year-olds. Okay. So this is not just a matter of get the medications out of the house to help the kids, right? Because who's dying are our brothers and our uncles and our neighbors, okay? Not just youth. And there's something I think about, I guess it's my psychiatrist, that we want to think about, we're going to do this to take care of the kids, which is important, but don't let that blind people who don't have kids in the house to what their needs are about keeping their medication safe, not having more around than they need. Their risk of exposing their brain to opioids and other drugs of misuse for which our brains were not really built to handle. So the prevention issues are extremely important, but not just at the child and youth levels, and funding is of course an issue. And then our other, tied into the other issue around access to treatment and et cetera, is we have never had an appropriate treatment infrastructure in this country. We've always had a piecemeal, mostly grant-based, small, not integrated, far outside even mental health treatment approach. And so our lack of access to treatment is not just access to treatment, it's access to treatment that actually is evidence-based and appropriate, because just like with prevention, there are things we can do that actually tend to make things worse or have a risk for worse outcomes. And so the building of the actual infrastructure is something that we're going to need to do before we're finally going to be able to put this issue and other issues to bed around addiction.
Wholeheartedly agree. Lisa or Natalie, want to chime in?
No, I just think that's so important. And like we find with our pharmacists just on the front line of that education of that prescription, there's a lot of education to do. Like I said, about the risks, about the disposal, about the concomitant use of medications, opioid and benzodiazepines being one of the most prominent, and just letting them know the risk. And the majority of patients are really surprised by the risks. When we do mandatory naloxone counseling on anyone who's receiving fentanyl, buprenorphine, opioid benzodiazepine combos over 50 MMEs, or any other time the pharmacist thinks it's necessary. And people are really shocked that we're offering them this product, because I think sometimes they think it's just for, what they see on TV with a heroin user or something like that. And it's absolutely important to get that product in those people's hands, but they're very surprised to find that there's risks outside of that. And so I just think that whole family education of the whole community, there isn't an age group that's exempt. Myself, I'm a mother of young children, but I'm a daughter of parents who are having surgeries and procedures done. And, it is hard. I think what John said was so important. My parents are of a generation where you don't throw things away that are still good. And that they don't want to do anything wrong, but they don't want to throw it away either. And so really educating people on why it's so important to do that is just really, really critical, but it's so multifaceted.
Okay. Natalie?
Yeah, so many of my thoughts have already been echoed, specifically around, as we're educating on the dangers of opioid use, we have to expand access to the services that support the concurrent issues of mental health and pain management. But something else I'll add in just through the context of the pandemic is the increased reliance on telehealth for behavioral health services. There is a significant digital divide in Kentucky as well as our state. So as we're talking about the expansion and administration of services through telehealth, we have to consider how the use of that telehealth may be leaving some people out of the equation because they don't have access to either digital connectivity or the devices that they need to use those services.
All right, well, I'm going to move on to our last and final question, and then we'll, if we have just a little bit of time, we can see if there's anything else anybody wants to chime in. But what do you want fellow Kentuckians to know about the opioid crisis and how it's being exacerbated by the pandemic currently? Who wants to go first?
I'll jump in first on this one
right,
since
okay.
other people have been gracious before. I think, for Kentucky, I just would want people to know that there are resources available even during the pandemic. The pandemic is not a reason to withhold needed care. Whether that be for substance use disorder, for mental health, or for any other serious health condition. We want to be cognizant of doing it safely. But I think there's a real risk of the care that's being withheld across the healthcare spectrum due to the pandemic. So I think that's extremely important. The other thing, it's been well publicized that the epidemic has hit Kentucky really hard, but I think there's still a feeling of it may be some other community's problem, or that's what happens over there. And just a realization that this pandemic does not discriminate. The opioid epidemic, it does not discriminate by socioeconomic class, by race. It is affecting everyone, regardless of stature. And so just not believing that it's someone else's problem. It's happening in your community, it's happening in your state, it's happening in my state and my community. And so I think when people start to recognize that, then you really start to get engagement, because it's not the neighborhood across the street, it's my neighborhood. And I think there can be more ownership there, but I think that's really important, that this is a non-discriminatory epidemic.
I agree. Who would like to go next?
Yeah, I think from my perspective, we had a small shutdown, or not a small shutdown, we had a shutdown of elective surgeries in the month of April and most of May. But as we've come back, we're extremely busy surgically, and all those medications that patients require. I mean, we're not anti-opioid. People need to have pain that's well managed, and so we work hard to find multiple pathways to manage their pain well. But we won't withhold opioids from patients. But my point is that those medications and those prescriptions are still entering our communities at a very large rate because of the amount of surgical volume that hospitals take care of, and that's important. And I noticed, I read a thing in the paper the other day that said by August, Lisa just said it happens in our own communities. I mean, I live in Fayette County, Kentucky, and Lexington, Kentucky, and it's big time in our community. And I saw a thing that in the local paper that said by August of 2020, we had as many overdose deaths as we had in all of 2019. And, I read story after story that talk about the challenges, the mental health challenges, and the people who are in active recovery during the pandemic, and they're struggling, and they relapse, and they go back to those things that they felt like provided them comfort in the past. And so, it's very important that we are cognizant of that, and that we continue to, all of us, to do what we do to hopefully make an impact.
To make an impact and continue to move this progress and this dialogue forward, and to make sure that we're doing all the things that need to be done within our community, within the education component, working with the patients, working with families, et cetera. So I agree.
Absolutely.
So who wants to go next?
Go ahead.
All right.
My message would be along the lines of Lisa's, with help being still available, and that the people who were dedicated to expanding these services and helping people through the opioid epidemic are still here and working as hard as they were before. So I, just continuing to put out that message, continue to publicize the services that are available. And really, I think a huge piece, and I borrowed this phrase from others that I've heard of before, is that social distancing can just be physical distancing, to still keep our social capital up, reach out to our networks and people for support, and really just help each other get through this.
Okay, so I would say couple of bullet points that I'd like people in Kentucky to know. First is that our overdose epidemic is worsened under COVID significantly, just as John said. Secondly, it's not just opioid deaths, right? It's deaths due to multiple kinds of substances of misuse. Related to the third bullet point, which is just because it's prescribed doesn't mean it's safe. It's only safe for that patient to take exactly as prescribed by that prescriber who had the full information about their medical situation and what else they were taking. Opioids are not the only controlled substance. They are nowhere near the only drugs of misuse that are prescribed. We need to be clear and sure about the other drugs of misuse and those interactions and their risks. And then I would say also that means get out of your home anything that you are not using now, because it's not just about you, it's about anyone who sets foot into your house at all. And then finally, I want people to know that if they Google ASAM, ASAM, American Society of Addiction Medicine, and COVID-19, it will take you to a landing page where we have out, I don't know, 16, 17 different kinds of guidance for people on how to negotiate prevention, treatment, recovery issues during COVID-19. And there's a wealth of resources there for people who want to attend mutual support groups or for different treatment providers that want to think about mitigating risk and et cetera. So I would have you Google ASAM and COVID for additional information. So thanks.
Thanks. Excellent. All right. Alicia?
Yes. The one thing that we would like for fellow Kentuckians to know about our programs, even though we can't physically continue the engagement like we used to, we still offer engagement. You can still be active, you can still volunteer, you still can make an impact. We just have to be creative how we do that. We still have avenues they can use. They can do virtual volunteerism, they can do remote volunteerism. So if you want to continue to volunteer and stay active to prevent that feeling of social isolation, we do have things that you can do and you can impact. And like I said, we were battling the opioid pandemic before the COVID pandemic. We can fully continue to, once we're past the COVID-19, to go back to that original battle that we were doing. So please, if you know anyone in your community, especially seniors right now, a lot of those relied on their senior citizen centers and activities to keep busy and to do things. We can still have good, positive engagement and you can still make an impact. Just reach out to us. You can Google us at moreheadstate.edu, AmeriCorps Seniors. You'll go to our landing page. It'll tell you all the different creative ways you can volunteer and be active. And also with the S&P grant also, that's also located at the Morehead State University website. And we also provide once a month, it's a free webinar in which we have different guest speakers, different topics in which we present on. We are going to be doing one over opioid prevention and addiction. So we will have different guest speakers on that topic. These are completely free. These are hosted through WebEx, so there's no registration fee. It's completely free. All materials can be sent to them prior if needed. If they don't have access to internet, we can send the copies of PowerPoint so they can follow along and just listen in on the phone. So those are some tool sets that we're still using. So those are free. They just simply call or email me at h.turk@moreheadstate.edu and I can register them for free. So that's a service that's still available. And just to everyone, just, you know, keep positive. Your mental health is just as important as your physiological health, especially during a pandemic when everyone's having to isolate. And even if it's just a phone call or a quick Zoom meeting to check in tutors with their students, it makes a world of difference. We're all in this together. Even though we're alone, we're still together.
I agree
Awesome.
wholeheartedly. So, all right,
Well,
I'm going to turn it over to Carol.
Thank you so much, Jana, and thanks so much to the panel. The discussion was so rich and so important today, especially John. Special thanks to you for coming right out of surgery and joining us. You're a great champion, and we so appreciate that and your efforts. We promise to stay in touch with each of you. You all provide valuable services throughout the state of Kentucky, and we are so grateful, and we'll keep track of your amazing results. So again, thank you. Happy holidays to each of you. We will provide the link to the recording for each of you. So again, thank you so much.
Thank you.